What a beautiful morning it is here in Iowa. It's Lynn Schrader with KHI, and also in the room with me is Janice Lavelle, one of our staff here in our Fort Dodge office. And so let's get going on our PPACA updates for agents. I'm going to do a little different spin today, and I want to share with you what happened with me yesterday and why we're going to go through this presentation today a little differently than we've done in the past. As you know, this monthly call every second Friday of the month from 9 to 10 is intended to bring you the updates to what's going on with healthcare reform. Well, as many of you know, I have been on the speaking circuit, if you will, for the last couple years, speaking to anyone that will let me come talk to them about the Affordable Care Act. And many times what I like to do is try to find agents in the neighborhoods where I'm speaking or in the communities and invite you in to help you make sure you can speak this message, that you become that expert in your communities. And I've been really preaching this for the last couple of years, that we know that this is what our knowledge of what's going on with healthcare reform will separate us from those that really don't understand, and ultimately we will gain more clients because of our knowledge of healthcare reform. The other thing that I've offered, and I will say thank you to Scott Schroeder, Paul Bowers, I'm trying to think of a few that have taken me up, Mark McGill, Chris Walker. These agents have taken me up. I'm sure I missed a few there, but those are the first ones that came to mind. I have offered to come into your communities and speak with you for your clients to demonstrate the knowledge and expertise that you have within you and, of course, within your general agency that supports you. So I invite you, if you find that to be appropriate in your areas, to take advantage of me that way. And the reason that I say that, if you haven't done this yet, and you're especially in the group space, if you play in the group space, and if you don't play in the group space, I'm inviting you to consider that, because there is such opportunity and such need for people that understand what's going on with healthcare reform, even if it's a 20-life group, even if it's a 5-life group. So if you're not into it, think about getting into it. If you're into it, the way that you commit to that marketplace is becoming that expert and making sure that they know, i.e. your clients know, that you understand healthcare reform. The presentation I'm going to share with you today, now remember, I can email this to you if you'd like. It'll be on our website. We're recording this call this morning. This is the presentation that I gave yesterday to a group of about 50 people at a SHRM conference, a SHRM meeting, Society for Human Resource Managers. And what I like to do is have my agents join me at these meetings, because invariably we end up with folks that are interested in talking to us. Why? Because their current agent is not bringing them this information. And I will tell you, I had 2 people come up afterwards and say, my agent is not bringing me this information, and I want to work with an organization like yours. So when you're an agent of ours and that's exactly what happened yesterday, that's how we partner together. I am there to make you look good. I am there to help you secure more business. As you get more comfortable and confident, you eventually will be able to deliver this presentation. I'm going to go over it with you today because we only have an hour, and I'm telling you, we went 2 hours yesterday, and we used an hour and a half of it for my presentation and a half hour for Q&A. And then I still had people stick around afterwards and ask questions. So I'm going to go through this rather quickly, only because we won't get through it all in an hour today if I go through every single bullet. But you need to know that the information that I'm going through here today is information that I would expect that you already know about. And we've got just, I think, a couple other announcements that I'll make towards the end. I've got some other announcements that, as we normally do, some announcements about updates and reminders. I will do those at the end, but I want to go ahead and get into this presentation today. And I hope as you follow along with me, not only am I educating you once again, even if you've heard this before, sometimes just hearing it again and again and again so that you can articulate that message. And then you present yourself as the one that understands this and can help your clients. They are still looking for people to help them. You might think, oh, everybody's got their broker, and those brokers have committed to this market. Remember, we've always talked, you either commit to getting all in or get out. And it's still, I can't believe it, but there's still agents out there that still have groups that they're responsible for, and they're not giving them this kind of information. And these employer groups are hungry for it. Okay, so, and the two cases, by the way, that approached the agent and I yesterday, a 49 life case and a 17 life case. So these are not little 2 or 3 or 1 person groups. The opportunities are still out there, you guys, and I know we're in a crazy time trying to get 12 ones renewed and 1 ones, but now is the time where you need to be reaching out to folks, letting them know, and even that, but maybe it's too late now to schedule another seminar, but you know, if you can get a seminar in, if you've never done one before, anyway, I know timing is probably, it was crazy, and I will tell you what, the AORs that are getting processed today, that these agents literally just picked up 2 AORs yesterday. They're getting processed. Remember, you get them in, and it's well-marked business. You got to get it in by the 10th of the month for a first of the month following. So the first step in taking this business over, of course, is getting the agent of record change form. And so today's the 10th. So the timing couldn't have been better for our seminar yesterday. I will tell you also, I've got upcoming seminars. I believe I've got 1 in December and 1 in January already scheduled, and one's in the Burlington area with the SHRM group, and another one's in the Ames area with SHRM. So I will make sure that I get these, and I probably have not done a great job of making sure you guys know where I'm going to be. I try to call my local agents in that area, but I'm telling all of you, so if that's a market that you serve, make sure that you find out from me when that is so that you can come and be there. Anyway, it's a great place where it's HR managers that are coming to these meetings, so it's a great place to network and get to know folks. Okay, so I'm going to jump into this presentation, then we'll stop for questions. Please jot down some of your questions as we go. Here's the agenda that I went through yesterday with them, and so we'll dive right in. And it's interesting because the timeline, and I did take this off of the Wellmark website, which, sorry Wellmark if you're on today, I don't think anybody is, and I didn't give them credit, but I found this in one of their presentations, and I found it really, really valuable. And even though it's kind of small print on the slide, and it was hard for the folks in the room to see it necessarily, but look at the visual, just visually look at what has happened in healthcare reform through into 2014, and we're almost at the end of 2014. So I think this really is a nice snapshot of what's happened, and then what yet is to come. So we'll get into the what yet to come, but I really like this slide, and we talked a little bit about the slide, but just take note there. And so again, this will be in the presentation if you want it. Okay. So then we talk about, here's the overview, and these are really the 5 categories that I always talk about as it relates to the Affordable Care Act. If you can't speak intelligently about improving coverage for individuals, shared responsibility for both individuals and employers, penalties, essential health benefits, and the marketplace, if you can't talk about this stuff, then you're in trouble. So you need to be comfortable with this stuff. So this is what we went through. And so I did this somewhat quickly as well yesterday because I'd already been there presenting a year ago. And so they had me back again to give the update. So we did a quick overview to make sure everybody's up to speed. I am still shocked. I don't know about you guys. I'm still shocked that some people don't realize there's still guaranteed issue out there, that there are no health questions in the individual market. So we went through that, and we talked a little bit about dependent coverage. And, of course, that impacts employer groups because they're trying to decide then what are the rules, Lynn, on when these people have to come off and that type of thing. And, of course, typically they get coverage in the month of their birth, but the first of the month after they've had their 26th birthday, typically that's when they're off that coverage. There are some plans out there we've heard, and I believe some of them might be self-funded plans, and they've honored that person can stay on until the end of that calendar year that they turn 26. So many of those you have to drill down and see what kind of plan it is, and is it fully insured or is it self-funded to understand some of the guidelines on that. Of course, the new hire waiting periods, and just confirming that they, of course, can't go beyond 90 days from date of hire. And then, of course, the rating. And, or excuse me, that new hire waiting period is in the group market, but it's interesting to know for individuals because typically, especially if you're in between plans. But then remembering how individual plans are rated with age and address and tobacco usage. and that's it. Again, no health questions. So we kind of reviewed that rather quickly. And then we went through the shared responsibility. And remember, there's two components to the shared responsibility piece of the Affordable Care Act. The individual mandate is part of the shared responsibility, i.e. all Americans need to have health insurance coverage. And that we review, again, the open enrollment and/or I call it the lockout period, and make sure that people are understanding that. The special enrollment periods where you're able to purchase or change a policy based on certain life events that happen. And as we've learned, and we're here to support you guys when you have questions with your clients, it can be confusing because each carrier can do some different things. Wellmark might do a 60-day from the date of the event, and another carrier might do 30 days. So anyway, it's good to know, and we've got all those cheat sheets to help support you on our team in terms of when are these special enrollment periods. But we reviewed that. Then we went into the penalties. You guys have seen this, so just knowing what the penalties are. And of course, I make the comment that the penalties, of course, in 2014 aren't stiff. But of course, look at how much more dramatic they get by 2016. Then maybe you're going to get some of those uninsured. And believe it or not, you guys, I still asked in the room how many know somebody who is uninsured. And still right now, there were several hands that went up. It was a lot less than a year ago when I did the presentation, but still a lot of hands went up of people that have chosen not to purchase health insurance. Okay, so then we talk about the shared responsibility for employers. And we'll get into a little more detail on the delay, but I do comment on it right here where I talk about the delay for the 100-plus full-time equivalent groups. Really, they were delayed from the 2014 deadline of 1/1/14 until 1/1/15, and then we know that some special provisions were made for those groups with 50 to 99 full-time equivalents don't really have to comply until 2016. And then we reminded everybody of the full-time work week is 30 hours. And then we talked about the two things, the affordability and the quality of the plan. So remember, the quality has to meet a 60% actuarial value. Cost must not exceed 9.5% this year. We'll talk about how that's changing and getting ramped up for 2015 just a little bit later. And then reporting of health insurance, 2015 or 2016. Now remember, if it's a group today that's over 100 lives and they have to offer coverage or pay the penalty by 1/1/2015, and or into 2015. Remember that when they file their reports, it's in 2016 report filing looking back on 2015. And as I was reading in the regulations a couple days ago, those forms have to be in by the end of February if you're filing paper, and by the end of March, like March 31st, if you're filing electronically. So they've got some different caveats there. Remember, too, that if you haven't partnered up with a CPA firm by now in your local communities, I will tell you one of the groups that was there yesterday and said, you guys, I want to work with you guys, was a CPA firm. And they're the ones, in fact, he just said to me, Lynn, we are just now getting all of the information around the forms and what we're going to have ready. Some reporting still is being done in 2015, so they'll need that as they look back in 2014, but majority of that really is going to hit in 15 and 16. So anyway, so reporting of the health insurance coverage, and we'll talk a little bit more about that a little bit later too. And dependent coverage. Now, we spent a little bit of time talking about this whole thing, and if you can grasp an understanding and show your value to your group clients around, are they going to offer coverage to spouses or not, and remembering that dependent coverage is mandatory. And that also means that even though that they must offer coverage to dependents, they do not have to pay for it. And so I think sometimes that's a misnomer that people don't understand. So make sure that they know you must be offered. They don't have to pay for it, but it must be offered. But spousal coverage, the offering of spousal coverage is optional. And we went into a long discussion about if spousal coverage is not offered, remember that spouse then can go into the marketplace and get their own policy and, based on household income, possibly qualify for a subsidy. But remember, if they're offered coverage, even if the group isn't paying for it, they cannot get a subsidy. So we had that big conversation because that is important as to whether or not they're going to offer spousal coverage or not. So then we talk about the penalties. And again, everybody knows about this usually, but this is the pay or play thing. And we've got calculators out on our website to help them determine pay or play. So if you need help, you let us know. But if you have a calculator from us that you can share with them, but remember, it's $2,000. So if they're supposed to offer coverage and they don't, it's $2,000 per full-time employee minus the first 30. If they're supposed to offer coverage and they do, but it's not affordable and it's not that minimum 60% actuarial value, then any employee that goes into the marketplace and gets a subsidy, the employer will pay a $3,000 penalty for every employee, or whichever's less, $2,000 per all their full-times minus the first 30, or $3,000 per employee, whichever is less. So, but again, here's what's interesting. If they're supposed to offer coverage and it's not affordable or quality, and affordable using the 9.5%, it's interesting because if nobody goes into the marketplace and gets the subsidy, then there is no penalty. So it's only a penalty if they go inside the marketplace, and then it's the lesser of the two. So that's interesting. Okay. So we talked a little bit about that. And then we also talked about the essential health benefits. And this is one reason why some of the ACA plans may be more expensive than the current grandmothered plans. And I'll refer to that word again a little bit later and talk through that. But essential health benefits, these are the primary ones. And remember, around the preventive care, there's also another list of preventive services for women's. It's women's preventive health. I don't have that included in this list because it's technically not part of the 10 essential health benefits, but it is part of women's preventive care, and that's what includes the contraceptive coverage at no charge, lactation devices and time to do that at no charge, counseling for abuse. I mean, there's a whole list of things that's separate under women's preventive health, but that's all bundled in under essential health benefits. And that's what can get somewhat political or controversial with a lot of people. And we'll talk about the contraceptive toward the end, not to get political or controversial, but to explain what's happened and what the updates are. So those are the 10. And I think the big ones, as we've talked about in the individual market especially, is maternity and mental health benefits that weren't built into the individual plans. They were add-ons, and you'd pay more for that. But that's part of the ACA essential health benefits. And then last but not least, in terms of the overview of the ACA, we talk about the marketplace for both individuals and groups. And so the marketplace for individuals, as you explained, here in Iowa, we have a joint partnership. Yes, it's this electronic marketplace. The intention, yes, is to increase competition. Yeah, how many plans do we have in our federally facilitated marketplace here in Iowa? We have 2 carriers is all. So it's really not increasing the competition all that much here in Iowa yet. I saw a slide from CMS that talked about increased insurance companies are playing in the marketplaces all around the country. There's a 75% increase in the number of insurance companies playing on the exchange, and they had a statewide, or a national map on there, and it had all these states color-coded, and I thought, oh, Iowa was yellow. Oh, and I looked over to the key. I had to make it a little bit larger to read what that key really said. And as I saw the yellow state and I looked over to the yellow key, it said, no change. So I was so disappointed because I was like, you know, we keep holding hope out that there might be more players to make a more competitive marketplace and make our lives more interesting. I understand that we have to know more carriers, but truly increasing competition, we don't maybe quite have all of that here in Iowa, and that obviously the metal plans and that subsidies are based on % of federal poverty level, and I go through that whole thing, and depending on your audience, you know, you can talk about federal poverty level being at about 11.5. That gets ratcheted up every year due to cost of living and whatnot increases, but I gave them an approximate number of 400% of federal poverty is sitting right around $46,000 a year for an individual, so we kind of walk through that. Again, reminding them that no subsidy is offered. They can't take it if they're offered group coverage. So yeah. So anyway, so you can kind of play off some of this stuff, but I don't have like notes per se. As you can tell, when you get to know this well enough, you see it, then you know where you're going to go with that conversation for your audience. So then we get into the marketplace for employers, also called SHOP. The SHOP marketplace, right? Small Business Health Options Program. And it was really, I'll call it defunct in 2014. They did not have the technology ready to do what they wanted to do. So what happened? You go out onto the exchange, into the marketplace, and I remember helping an agent help one of their clients, and we did it all online. And it said, congratulations, you got it, print this certificate and take it to your CPA. Well, at some point, they stopped doing that. I think they've moved to a paper form is what, now I haven't been out there since, but I was told that. And then you have to send that in, you have to send in your qualifications and then have them send it back. So I don't know if, and we get to the Q&A part, if you know that you can still do that online, if you've been out there recently with the group, let me know, because the information I was given is now they're going to have to, they go out to the marketplace, they download a form, they fill it out and send it in, and they'll be notified. And I'm thinking, that's backwards. So why are we going that way? So I don't know if that was just temporary, something was wrong with the site, but chime in if you've gone out there recently to see if you can still do it electronically. But remember the idea, and this is supposed to happen now here in Iowa, 1/1/15, that the idea was a employer group, 1 to 50 employees, could go out to the shop, register, and then tell their people, I'm going to offer you the bronze and a silver plan. Those are either of those two you can choose from. And typically it would be combined with a defined contribution, right, where I'll say, I'm going to give you $500 for the month. And now you go out there and you find a plan, and you've got $500. If you choose a plan that costs you $600 because you're buying one for your family that's actually maybe $1,000 a month, I'm still contributing that amount, and you can pay the balance. They could then choose from any bronze or silver plan, so they choose the level, and they could choose any bronze or silver plan with any of the carriers on the marketplace. Well, that sounds cool. That sounds great, but guess what? Co-Opportunity Health is the only health plan on the SHOP exchange in 2014, and I haven't heard anything about any other carriers yet. I think they needed to have told us if they were going to do that yet. Now, we'll know for sure probably first part of November. As you've heard, both Wellmark and Co-Opportunity say that we don't have confirmation back yet from the insurance division approving their rates and plans. So we're waiting. So, I mean, unless something miraculous happens and Cigna jumps in or Aetna/Coventry jumps in at the last minute into the SHOP exchange, we're going to be down to a one-company game again in the exchange. And remember, too, the reason that a small business would do this is because they can then get perhaps some credits, some premium tax credits. So let's go to the next slide. Here's where we talk about, and I make sure these small groups know that to qualify, you need to be a small employer, 50 or fewer full-time equivalent employees. Of course, this is to play in the shop. You have to have 50 or fewer. Remember, in 2016, that goes up to 100. But to qualify for the tax credit, you have to have fewer than 25 employees. The average salary is under 50, and you can't count owners or family members in these numbers. You pull family members of owners and owners out of the calculation, and the group has to contribute at least 50% to the premium, and they can qualify for up to a 50% credit for for-profit companies and up to a 35% premium tax credit for nonprofits. So this is still a viable program. It's in play for 2 consecutive years is when you get it. Once you've been in the shop and you've purchased, whether you qualify for that or not, you can, again, you can stay in the shop, as we said, whether you qualify for the premium tax credit or not, but you can't get the premium tax credit unless you buy through the shop. And there was some questions on this. I heard an agent at one of our training sessions say, what? I didn't realize that. I thought a small employer group, if they qualified under that fewer than 25 employees, et cetera, that even if they went with Wellmark, they could get the premium tax credit. That is not true. They must go through the shop to qualify, and they must purchase Co-Opportunity Health because they are in the shop program. They have a qualified health plan inside of the marketplace for employers. So just a little heads up there. But this approval that they're going to get from the government is literally what they take to their CPA when they do their taxes in 2015 looking back on 14 or 16 looking back on 15, okay? So a lot of confusion there, but it's going to change again because they're saying November 1, we will have this technology for an employer group to go in and actually register. We never had that capability before. I haven't seen a sneak peek of it. Marcy and Eric and Jess and I on the Health Underwriters Board, we serve on a coalition, if you will, of folks that are in communication with HHS. In fact, the gentleman that came and spoke at our symposium this last fall is kind of heading it up, that Kit Wager, or whatever his last name is. We're on some monthly calls. In fact, I believe our call is next Tuesday, dialing in to them. And what we're doing is giving them feedback about what we're seeing out in the field. And it's interesting. So I asked them, and we're not one of the states obviously piloting this, but they have some states that are piloting this and getting in and running some interference and doing some testing. So hopefully when we get access to it, probably right around November 1st, hopefully they'll turn it up for us so we can at least get in and start playing with it. The other feedback that we've given them, I'm going a little bit off subject here, but or off script, but the other feedback that I gave them very strongly is that you need to create a broker portal so that we can log in on behalf of our clients and see what's going on there. One of the comments I heard Jess make at another training event is they heard our feedback as well in the individual exchange. I digress for just a moment. They're going to move the quote tool up to the front so that people can just get in and look at plans without having to set up their account, answer all the security questions, see if they want to qualify for a subsidy, and then look at plans. They realized they made an error there, so they've moved that quoting or shopping experience to the front, and then once you see what you want, now you can apply and go through the process to see if you qualify for a subsidy. Okay, duh is all I have to say about that. So anyway, communication is at least happening between us in the field and CMS, and if you've got feedback, get it to Eric Kohlsdorf, Marcy Strauss, Jess Patton, myself. I know for sure the four of us have been on these calls. Let us know, and we'll make sure we get your feedback if we haven't already shared that on those calls. Okay, so now back to the presentation. So then we get to the part where if you like your health plan, and I love this because when I do the presentation, I let them finish that sentence, and they all do. In unison, they say, you can keep it. Okay, so this is what happened there. Individuals, when we look at the different segments, right? Individuals who are non-grandfathered, which we call them grandmothered, right? Which got a lot of laughs in the room, and then we were asking where the grandchildren were. But anyway, the non-grandfathered plans that are non-ACA, those are called grandmothered. Those individuals may keep those plans until January 1 of 2016. Now remember, this is the government coming out and saying, we're going to allow this, now we're going to push it out to the states. The states could make a decision, and I remember Commissioner Gerhardt came out, you guys remember that day, he said, okay, we're going to allow insurance companies that have these grandmothered plans to allow their people to stay in them until 2016, but some carriers chose differently. So remember, if you have any individual Coventry business, Coventry is saying you will not keep your grandmother plan any longer. You will convert over to an ACA plan. If you're grandmothered, you must convert to an ACA plan by January 1 of 2015 for those Coventry clients, okay? Now, Wellmark, taking a different approach, of course, they're not in the marketplace. Coventry is in the marketplace and the individual side. Wellmark's not, and Wellmark's individual policy says you can keep them until January of 2016. That's the latest date the government has allowed, and Wellmark has allowed that as well, okay? So the groups then, 51 to 99, have been delayed until October 1 of 2016. They must have converted over by October 1 of 2016 or pay a penalty. So they've given them a little reprieve, right? And that's very helpful. I've talked to several of you that have groups that are in that place, and they have another year to really sort through this. And then the groups that are 100 plus must offer coverage or pay the penalty. They must offer coverage by January 1 of 2015, but need only offer coverage to 70% of their full-time employees versus the 95% that had been written into the law. They will get that 95% the following year. So then by January 1 of 16, they need to have 95% of all their full-times covered and must, of course, maintain a 60% actuarial value plan. Now remember how interesting this is, because remember the 1 to 50 today that is part of SHOP and part of the mandate with all these bronze, silver, gold, and platinum plans and all the essential health benefits, et cetera. Remember, that bar goes up to in 2016, that bar goes from the 1 to 50 to 1 to 100. So all of a sudden, those folks that are in this 51 to 99, they're really getting a little bit of reprieve here, right? But then certainly by 1/1 of 2016, they can look at getting into the SHOP, and they are considered now small group, and then large group is that 100 plus. But right now, large group is considered 51, right? So, okay, so we talked about that, and then we talked about the employer's responsibilities. Now, I'm comfortable with this layout. You might like a different layout as you present this, but it doesn't matter. You guys need to become the experts in your community and delivering this, and that has been what I've been talking about these last 2 years. And so my hope is today that you're looking at this with not because, Lynn, I know all this. It's Lynn. I'm thinking I would like to move that slide somewhere else, and I will deliver this. And I'm here to give you this presentation. Now, one thing I didn't do for you, and you will want to do, is add a disclaimer slide. And that disclaimer slide just says, I'm not here giving tax advice, I'm not here giving legal advice, et cetera. So, and I can help you with that as well. Okay, so on the employer responsibilities, make sure that they're delivering. And I reminded them, I go, how many people remember you had to give notice of the marketplace? And that was, we did that a year ago, right? Where they had to make sure that people knew that January 1 they could go into the marketplace and start buying their own individual policy. Every employer, regardless of whether you offered coverage or not. If you were part of the Department of Labor and Fair Labor Standards Act, you're going to have to give this to all your employees, full-time, part-time, seasonal, it didn't matter, give them notice. Okay, so assume that happened, then after that, every new employee was supposed to get notification within 14 days of when they started. So I was kind of looking at, well, I trust you guys are all doing that, right? You remember to do that as you get somebody, put that in your new hire packet. Then the 90-day waiting period, we kind of already talked about the reporting of the health insurance on the W-2s. This is always a question, and I looked it up again with the beauty of the internet, and I confirmed that, remember, the number that's being reported today on the W-2 box, it's not mandatory for anybody under 250 full-time equivalents, but for anybody above 250 or above, they're already reporting this. That number that's in that W-2 box is the total cost of health care for that employee. That's what's being reported, not just the employee's contribution, not just the employer's contribution. It's the total that is paid for health insurance premium for that employee. And it's interesting because my skepticism says at some point in time that will be taxed, is my fear. Now, the regulations are quick to report. This is not taxed. It's being reported, and the reason behind it for now is so that that employee can see the benefit of what they're getting along with their pay. And right near that box will be the 401k contributions. And so it's helpful to see the overall compensation, and that was supposedly the intent. Now, again, I'll try not to be a cynic, but now you know, though, that is the total cost of health care. It's not just the employee's portion or the employer's. It's the total cost of that plan. And then the employee can very easily peel out their costs because they should look on their tax stub and see what they're being deducted pre-tax. Remember, it's all tax-free, so they're being deducted pre-tax out of their paycheck to pay for that. The minimum essential coverage and the applicable large employer, both of those, 6055 and 6056 are places in the regulations inside of the law. If you want more information on this, Nakia, on behalf of KHI, you should have gotten it. It's our HR newsletter. Hopefully everybody gets that. And it's fantastic. There's some great links built into there. It's through our partnership with HR 360, and we call it KHI HR Solutions. So remember, when you have those groups, get those logins so you can give one to your employer group. But the information there is phenomenal. Talk to them about the forms and all this kind of stuff. Now, this is where I gave my plug. Now, you don't have to, and it might sound shameless to my audience yesterday, but I said this is where, I don't care who you use, but I'm going to tell you about a partnership that KHI has developed with ADP. And in fact, before I said that, I go, how many of you have heard of a small company called ADP? And they all laughed, right? And these are all HR managers, so they're very familiar, I'm sure, with payroll processing systems and the act of collecting time cards and that processing payroll. And then the third step of that is ACA reporting. And you guys, there's so much more to it than two forms called minimum essential coverage and applicable large employer. There's so much more to this because it really has to do with two things. And we spend a lot of time talking about this. Think about it. There's really two look-back periods for an employer. The first look-back I have to use is really around, I'm going to use that and call it pay or play. It's, do I have to offer coverage or not? Am I an applicable large employer or not? Do I have 50 or more full-time equivalents? That's the first look back. That's where you can look back 3 months, 6 months, 12 months, have your look back period, right, to determine, am I an applicable large employer? Do I have to offer coverage now? This helps you determine, too, am I within that 50 to 99, or am I at the 100 plus? So I know if I have to offer it 2015 or 2016. Okay, so that's the first look back. The second look back is all around, when I look back, who am I offering coverage to and making sure I'm providing the minimum essential coverage to whom? So when I look back and I had somebody that worked under 30 hours, no, I don't offer them coverage, but did they stay under 30 hours during your look back period? Now the look back period here to determine who I need to offer is either 6 months or 12 months. And the caveat here is, remember, if I'm looking back to determine, okay, I'm already offering coverage, okay? Let's just say I got 55 employees and I'm currently offering coverage even though I maybe don't even have to, but I do because it's part of my value proposition. So if I'm offering coverage, am I offering it to the right people at the right time? And that's that look back. So again, that gets into when you deal with an employer that has a lot of part-time employees or variable hour employees, on-call employees. That question came up yesterday, and I'm doing a Q&A following this, and I will make sure that we get that posted for you guys because one gal raised her hand and said, I do have variable hour employees that are on call. And when they're on call, how do I do that? And on their on call, their variable hours, how do I calculate that my plan's affordable? And there's a caveat, and I remember reading this in the law. So I told her I will follow up and I'll get that part of our Q&A. So you're going to get some of those kinds of questions, and that's when, if you don't find it yourself, you give us a holler, and we'll help you find that information. On that one, I will have it. And another one all around temporary staffing. Larry, if you're on the call, many of you agents have temporary staffing firms you're working with. There's additional interpretation, or additional guidance, I should say, around the look-backs for temporary staffing firms. Also for these on-call employees. So anyway, use us. That's how you give us a holler, of course, and get some additional information there. But I'll just say, Larry, if you're on and you haven't gotten what else you need, I know I had another reason to drill down into that stuff, so I'd be happy to visit with you about it. If you guys have that situation, make sure you get a hold of me, and we can talk through that. And then I'll go back to the ADP thing real quick. All I said was, in our relationship with ADP, they will come out and do a no-obligation consultation to look through your payroll collection of time and data, to the payroll processing, to your ability to do the ACA reporting. And they'll try to find, and I love I'm quoting their term, they said I could use this, profit leaks. They're looking for places where there might be profit leaks in that system, where they can show the ROI on why investing in a system like ADP has will not only help you reduce your profit leaks and help pay for, because this is a cost, there's a price to their service, help pay for that service, but also keep you compliant. And don't hesitate using the word compliance, because that usually gets people's attention, because nobody wants to be out of compliance. There's penalties that can be assessed. And they're scary. So use the compliance word, and whether or not it's ADP or if they've got somebody else they want to use, and you might just say, hey, I don't care, but you need to have something, because let's face it, you as brokers and us as your GA, we're not doing those reports and those forms for the employers. It's their responsibility, unless you've decided to do that. Now, some agents that might be on the call have established a compliance department inside of their agency, and they are going to do that, but they'll charge for that. Absolutely. So that's okay, and whatever they want to do, but make sure that they know that's so important to make sure that somebody is doing these reports. If you have any questions on how to get a hold of a rep from ADP, they've got reps all over the state, just give me an email. I'll connect you with the right representative. For those of you that are at some of our fall training, you met some of those folks, but they are going to be invaluable to you as you continue to show your value in bringing the partners together to bring that solution. And then funding, for the plan year 2015, I want to make sure you know that they just ratcheted that up. So now instead of 9.5, it's 9.56%. And Nakia just found a great calculator. We're going to throw this on our website for you guys so that if you've got an employer that wants to play through that whole, is my plan affordable? There's a little Excel calculator, and you can find them out there as well, but we found one that Nakia really likes. So we're going to put that out on the site, and of course it'll be adjusted for this 9.56. Right now it's set for the 9.5, but it has 3 different ways the government has approved you to look at the numbers in terms of that employee, their pay and or hours, and make sure that they stay within that 9.5% to be considered affordable. Okay, and I know we're covering a lot of information, but I do want to leave time for questions. So we're kind of getting to the end of where I wrap up this, and I know I've gone super fast, but the next agenda item was all around legislative activity. The small business deductible cap that we know was there, of course, is gone. Many end users don't realize this. They maybe realized that it was there or didn't, but I had a couple tell me I didn't realize that this was stricken. So we know that through legislation, and we're so thankful as our industry partners for both NAHU and NAIFA rallied to our representatives in Washington and got bipartisan support to draft legislation to eliminate the deductible cap in the small business market. It was ridiculous. It should never have been there in the first place. So that is gone. Then we get to the contraceptive coverage. The reason I share this on legislative activity, again, think about you're projecting yourself as the expert to your clients. So the fact that I'm here to help you stay current on what's going on, which is why I know you dial into these calls. So remember what's happened most recently in the Supreme Court. We talked about it last month, but there's been another court case in Oklahoma that ruled the same as the court in D.C. And the appellate court in D.C. and now the court in Oklahoma both agreed that the federally, and I'm going to go, sorry, I just skipped down to the federally facilitated marketplace. I'll get back to the contraceptive coverage in just a second. I got excited about the Oklahoma case that just popped up. The subsidy eligibility for states in the federally facilitated marketplace, now the Oklahoma court sided with, had the same decision as the Washington, D.C. court, that it is not in the law that the government should be subsidizing those states that do not have state-based exchanges. That's Iowa. We have a federally facilitated marketplace. Therefore, technically, 2 of these courts have agreed we should not get subsidy dollars. The court in Virginia said, yes, you should. The intent of the law is to give it to all individuals, regardless of whether they're in a state-based or a federally facilitated marketplace, but that's not what the law says. So I'm keeping you current on that one. We believe that will go to the Supreme Court in 2015 because you've got courts that are dissenting. If you had all courts saying the same thing, it probably wouldn't go. It would follow suit with what the courts are saying. But when there's dissension, it'll probably make it to the Supreme Court. Okay, back up to the contraceptive coverage and the Supreme Court's decision there. On that one, as you know, we talked about the Catholic Health Initiative. So the Catholic Church got involved through their Catholic Health Initiatives. And that's their Catholic charities, their Catholic hospitals and schools and all the things that the Catholic Church is involved in. And they got their waiver. Well, then that was nonprofit, and it's about, you know, it's kind of their own, they kind of proselytize their own beliefs. They hire people with the same beliefs, et cetera. Okay, Hobby Lobby then presented the next court case. You guys know about that. And so the audience knows this, but to bring them up and go, okay, the issue is this, that they called it closely held, i.e. privately held company, has the right, a privately held company, even for profit. So remember, the Catholic Church was the nonprofit. Of course, you can tell it's not a General Motors, right? So now they're saying, though, with Hobby Lobby, you can't be a publicly traded company and make this decision, but if you're a privately held company, you have the right to not offer contraceptive coverage on your health plan, your group health plan. And so that's an interesting one. So make sure people are aware of that. There are a lot of people with convictions about this and will want to be able to make changes to their plan based on this. I find that very interesting. So again, in the know. And then the other thing that's pending there is the definition of full-time employee. And today, as you know, it's 30 hours or more is considered full-time. And we know that that has, I think, wreaked havoc on our economy. It's not gone in the right direction where, and a great example are people in the schools. I've seen teachers' assistants that are working 32, 34 hours a week, and that was considered part-time in the school system, and now the school either laid them off or dropped them down to 26 hours or something. And anyway, you know the story there. So tell that story there about, but that's still pending, and we keep an eye on that, and I keep you guys posted. Now this is where this is the exciting part, because this is where I think you add dramatic value. All that stuff I think is good. Maybe they expect you to know all that, but here's where, and I think this is what really captured a couple of those folks in the audience yesterday that said, my broker's not talking to me about this. So this is, again, our value add, your value add, and what makes you different from your competitor, and that is talking to them about defined contribution versus a percent of premium, and bringing up the concept. Now, you guys also know that we have a wonderful relationship that we enjoy with Advantage administrators. So if you have any questions at all and somebody starts talking about defined contribution, you can do it today. I had a guy go, well, I thought I could only do that on an ACA plan. I'm like, oh my goodness. Oh, no, you don't have to wait until you have to be forced, from your grandmother plan into an ACA plan to adopt defined contribution. You can be looking at that right now. You guys, there is a thirst out there in the marketplace for people to tell them about how can I do defined contribution. And I know many of you are doing a wonderful job with your groups, but just know that there's more folks out there that are not getting this from their agents. This is an opportunity. Talk to Dietrich at Advantage Administrators about defined contribution plans and what they can do for us as a third-party administrator and help out the clients here and do that joint call. And remember, it's all about bringing in your partners. We don't have to know it all. We have to know our part of it, but then we've got great partners to bring in to help us. So whether it's ADP, it's Advantage Administrators, you can see where they jump in here. So be talking about that. The next thing I talked to them a lot about, too, is the qualified high-deductible health plans and health savings accounts. And I really, now this is my opinion, I try to hold back my opinion, but it's my opinion that the future is bright for qualified high-deductible health plans and health savings accounts. I think most of you know I do a 1-hour continuing ed through NAIFA. I travel around and I give this presentation on qualified high-deductible health plans and health savings accounts. And I'm passionate about these because my frustration in prices not going down across the board. Now, we have had some renewals. You guys have seen them, right? Some renewals are coming back with a negative rate increase, which is like you want to sing hallelujah on that one because that's crazy, crazy good. And so a lot of those grandmother plans are going to sit tight, of course. But some of them are getting, I think we saw one as high as 87% rate increase or something really crazy. Maybe you guys can top that. So what are we going to do? And so you talk about how to drive down the A in affordable care. How do we make it more affordable? Because from my perspective, there's not a lot going on that's helping to drive down the cost. With your ACA fees, with the minimum essential benefits, with the per member rating based on a group's demographic that can drive up costs. And there's no wellness, there's a wellness component, we'll touch on that next, but there's really no, healthier groups in the past, right? Hey, if we stay healthy, we can impact our claims. That's still true with our grandmother plans today, but in the future, as we know with ACA plans, we know that at least in the 1 to 50 today and soon to be 1 to 100 market, it's all based on how old are you and where do you live and do you use tobacco? So that wellness component kind of goes away, but this way, through these plans, start to leverage that, and then make sure you're talking about the tax treatment, because this is where you might get into somebody going, well, and we just found one of these with another agent. We're doing an HRA, and we're reimbursing for individual health plans. Okay, get Dietrich going on that one, right? Because our view on that is you are out of compliance. Your firm is liable for tax penalties. You cannot be offering an HRA, enjoying the tax benefits of that as an employer, and reimbursing individual plans. So that was announced. I know we talked about that on a prior call, but that just drives the need to be talking about defined contribution plans, qualified high-deductible health plans, and the ability for that employer to put money into an employee's health savings account tax-free. So instead of giving you more money and say, go get your own plan, why don't I give you money, we'll put it into your health savings account, oh, and by the way, here's my health plan, right? And looking at premiums and et cetera. And I'll tie this all up, I think, in a nice, neat bow at the end. once you start talking about these kinds of things and what's really going to work for that employee, right? Which really just dovetails into wellness plans and making sure your wellness plan is compliant. Did you realize, and again, I'm talking to these clients out there, they don't realize that a wellness plan has to be compliant. It doesn't just have to be compliant so they can get their small business tax credit. It has to be compliant if you're offering a wellness program, period. They have not come back with, you remember somebody said they took away the credits for the wellness program. Let's say it this way. The guidance has not been written for how they're going to issue the tax credits for wellness plans. So yes, temporarily there is nothing in it for the employer to offer it, but it's the right thing to do. In addition, if you're going to offer it because it's the right thing to do, you can tie it in with a qualified high deductible health plan and put money into their health savings account tax-free if they meet certain wellness thresholds, but they have to stay compliant. They can only pay so much to each employee or they'd be out of compliance. And it's a percentage of the premium that's paid for their health insurance, okay? So if you didn't know that, you know that now, and if you knew that, it's just reminding you. But again, this is the stuff that you share with your people, and I'm telling you, they'll be like, great, when can I move my business to you? And then self-funding arrangements. This was wonderful. I brought self-funding, and you've seen, we've got some companies that will go all the way down to probably 20, 25 employees. The target market for self-funding at the lower levels, typically in the past it's been about 100, right? And you start creeping down a little bit, maybe 70, maybe 50. They're creeping down to 25. What's your target group if this is going to work? Either A, it has to be big, so you've got the economy of scale and you got the numbers, right, going in your favor. If you're small, then you better well be a darn healthy group. So a lot of groups that are really focused on their health and wellness, maybe that's their company. They deliver health and wellness, or they're all personal trainers, or I don't know what the case is. Those folks might be a great candidate for self-funding arrangements. So a lady pops up or raises her hand and she says, we do partial self-funding. And I said, beautiful. That's going to be halfway in between now. You're fully insured and you're fully self-funded, right? So we talked a little bit about partial self-funding, and that goes right into it. In fact, I probably should list that on the slide. That's really self-funding arrangements, which includes partial self-funding. And that's really where you might be buying down the deductible. You might be helping to offset co-pays. I mean, you can do whatever you need to do, right? It's really get creative, and a lot of folks are saying that's great because I'm going to buy a higher premium plan, but I'm going to buy down that deductible, and I'm going to have some premium savings. And maybe I'm offering that HSA, and now I can finally start to seed that HSA account for my employees that take it for the first time. And then think about different ways that they compensate, whether it's defined contribution, whether it's you're paying 100% if they take an HSA plan, I'll pay 100% of a single premium. Think about that. So we kind of talk through strategies around why and when should I offer these benefits. So that goes right into the last slide as we wrap this up. And you might want to put this right at the beginning, and maybe you put it at both places. But think about, and these are the things that I really strongly believe that this is why we do what we do. It's so that the company that you're serving can make their widgets, can provide their service, and not worry about this because they've got the right people in place to do what they need to do best, and let us worry about health insurance, the benefit package, the dental, the vision, the voluntary products, all the other things that we can bundle in here. When I started talking about these bullets right here about turnover inside the organization, I can't tell you how many heads I'm seeing nodding, and these are HR people, right? So if you should get connected with your local SHRM chapter if you're not, I'm telling you, and then either bring me in or you deliver this. If you're comfortable, do it. But these are the key, this is your audience. And so be talking to them about these things. And then the other analogy I use is putting another arm around your employee when you offer them additional benefits. It makes it harder for them to go somewhere else. When I offer you dental and I offer you vision and I brought up the Legal Shield product that we picked up. As you guys know, we're a general agency for Legal Shield and identity theft protection. We put another arm around all of our staff and bought it for our staff because we felt it was that important. It was like for $15 a month per employee in my company, they all have identity theft protection paid for by KHI. Why? It's a little selfish, and they know this, but if they get hacked, I don't want them spending time trying to clean up their credit. I need them working in my business serving you. I bought it so that they can sign a limited power of attorney and have that company clean up their credit. Okay? And that Legal Shield with identity theft is the only company that I'm aware of in the marketplace that has licensed private investigators on staff that you sign your limited power of attorney and they'll clean up your credit for you. So that's, to me, that speaks to me as an employer. These are the things, so as I'm sharing these kinds of things, you see how, I mean, to most of them, I think they realize, am I selling? Sure. But am I selling? Does it feel like I'm selling now? When I'm trying to talk to them about how to attract and retain top talent in their organization, and if they're not leveraging their benefit package to do that, then shame on them. And they're not going to keep people. So let's go back to using this the way it meant to and stop worrying about, you know, do I have 50 or not? Should I be offering benefits or not? Granted, we have to care for all those and we have to do the counting and all the forms. But like I said, focus on what you do best and partner up with the firm that can help you, you know, with your company and keep your folks, keep the good people, and do the things that we're trained to do. So it's still out there. Then I wrap with questions and comments. And I'm going to, before I wrap that and do that for you guys, as we have a few minutes left, and I think we can go a little bit over if we need to, but I just want to make a couple other announcements. If you sell Co-Opportunity individual plans, you need to get certified in the marketplace. If you want to get paid in January, you've got to get it done by the end of October. Get those certificates to us. Get them to Nicole. Nicole will get them sent in to you, and we'll have copies of those so in case they ever challenge us. And that was new to us when we did this Co-Opportunity training. They are not offering any individual plans off market. It's all through the marketplace. Subsidy or not, it doesn't matter. They're funneling every new sale in the individual market through the marketplace. They are offering, and we at KHI, we are mandating this training. Why? Because we need you to know what this is all about. So if you're going to sell Co-Opportunity Health, you have to go to training. If you went to their classroom, you got a CE credit, great. If you missed the classroom events that just got done, then these are some upcoming webinars. Get on one of these webinars so that you can be certified to sell Co-Opportunity Health. You have to know this stuff or you're going to be lost. There's so much information. Okay. If you need more detail, it was in their broker alert. Just holler at one of our staff in terms of the locations. I just wanted to put some dates on here for you to check your calendar, but you'll obviously we don't care about locations. Sorry, these are webinars. These are webinars. So wherever you are, get these. If you need the registration information, I meant get to our staff. In addition, this is Wellmark now. I'm going to switch gears with Wellmark. The queue for ACA January renewals will be in queue by 10/13. We're being told that right now. So here we are on the 10th of the month, which, by the way, today's the deadline to get in any agent of record changes to be effective 11/1. Just another reminder there. But so they're saying the ACA January renewals will be in queue by October 13th. That's Monday. Another announcement here on Wellmark is, and I apologize, I got this handed to me by Nakia just as we were starting the call this morning. The ACA renewal proposal, will be mailed to groups around 10/23. The ACA renewals are required by us to be mailed to the group. The ACA renewals are required by us to be mailed to the group. So that's a Wellmark thing, not a KHI. So what they're saying here, the groups will be mailed around 10/31. That is a requirement of Blue Cross. They're saying that they will be doing this. So the goal here is, and as you guys can tell, they want to make sure that all of us as agents are getting these renewals turned around. So we do our best. We look them over. I want you to know we don't just get them in and send them out. We look at them. We make sure that we've got the accurate information. We then want to send it to you with some tips like, please note, so-and-so is 65 or whatever, right, with some of the demographics. So we'll look some things over and offer some tidbits as we get these out to you. Now, I know we had a lot to get out right in early September, and then here's coming the next rush for the 1/1s in October. So, okay, I'm going to stop there. That was the end. I'll go back to our question and comments, and let me open up for questions. I know that was a lot of information. I hope it was helpful. The ACA overview slide was good. Okay, great. And so you'll get that. In fact, if you want this email, just send me an email and just go, Lynn, just email me the presentation. We'll have it posted out on our website, but if you really need it sooner than later, it's usually posted by the following Monday. I get Nicole to help me get this on there. But if you need it sooner, just let me know, and I will send it to you if you're interested in delivering this presentation or you want to pull out one of those slides. Okay, other questions or comments? Let me look and see if you can raise your hand or you can type a question, and I'll scroll down here through to see if I have anybody that's raised a hand. And it looks like Marcia, I'm going to unmute your mic, and if you're live, go ahead. Marcia, can you hear me? Okay, you might need to ask a question, type in a question. So I'll go ahead, and you might be on your computer where you don't have a microphone. So I'm going to go ahead and mute you back out again. And Paul, I see a question there. I'm going to go ahead and unmute.
Good morning, Lynn.
Good morning.
I have a couple of questions on the shop aspect. The family members that are being excluded, even if the family member is an individual employee and not part of, so you know they're an adult, so to speak, living on their own, and they're getting health care coverage on their own, so on and so forth. Do they have to be excluded? They're not an owner.
Okay. Are they working in the business?
Yes, they're working in the business, but just as an employee, they're actually not a part owner. So, I mean, that's kind of foggy. And then the second part of that shop question is, I heard the 2-year tax credit. Is it only the tax credit only good for 2 years?
It is.
Then
2
what do we do?
consecutive years. It doesn't matter when they start, but it's just 2 consecutive years, and then they're done. Yep. I'm with you.
What brain surgeon thought that one up?
I'm with you. Well, and
Holy
my thought
cow.
is, well, and as you guys remember, this idea of having employer groups continue to offer their coverage so they don't drop their plans and send everybody to the marketplace, I think, remember, because this credit started back in, like, was it 2011, I'm thinking? I'd have to look back on the timeline when the credit actually started. But it was interesting how they could do it then. They just couldn't, there was no marketplace. Now there's a marketplace and they can do it. So whenever you started it, you only get it for 2 years. And this is maybe my cynicism again, but it's let me get you into this program, and once you start doing it, you'll keep doing it. So that might be my thought on that.
And then
but the family member thing, Paul, sorry, back to the family member real quick. I mean, if I'm an owner and I've got my son or my daughter that's working, it's a family member of the owner. We pull them out in terms of the calculation of how much, in terms of the, which is usually a good thing in terms of do they average less than $50,000 a year? Because sometimes owners pay themselves more and they pay their family members more. And then the other part is, but they're not also getting, they don't get the premium tax credit on that premium for that member. So they're defining it as an owner or a family member of that owner.
Right, and I guess where it gets a little muddy for me is that obviously the family member is filing a separate tax return completely. They're not getting any benefits from mom and dad. So I look at them as an employee, and I may be way off because they don't have ownership in the company at all.
No, but they're remember now, even though they're an employee, this is not penalizing them. This is, if you had to say penalizing, this is taking and giving that employer, the owner who owns the company, giving them less tax credit. They're not counting them, and they don't get the tax credit based on that family member's income, but that family member is fine to be covered. I mean, they can get health insurance, you know what I'm saying? So it has nothing really to do with that employee's tax return. It has everything to do with the employer's tax return.
All right, I got that. And then the last one would be on AORs, and I think I had this in some clarity brought to that when we had this in a group discussion some time back. If you do an AOR today, for clarity, you can go from plan, like if it's a particular plan, you just AOR it straight across. We were allowed to do that with Farm Bureau clients as well, but if you do that with a Farm Bureau client, you're taking them out of their grandmother or grandfather status over to an ACA plan.
Yeah, so the AOR rules around group and individual are different, and I'm specifically talking Wellmark now. So in your example, that would be an individual AOR. And I didn't really talk about it today, but the AORs in the individual market, you have to, there is a form, and you can take Farm Bureau. Remember, Farm Bureau has unique products, and you're right, if it's a Farm Bureau grandmothered plan that's not offered on the what we call the direct pay side or the independent side, you're right, you can get that AOR now, but you are changing them from their Farm Bureau grandmothered plan to an ACA plan. And that's why Wellmark said, if you're going to do that, we'll give you, you'll become the agent of record because you just wrote a new ACA plan for that client, and they will become yours. But we're probably going to call that Farm Bureau member and make sure they realize what they just did.
That's all. Thank you.
Yep. Thank you.
Besides, I'd like to follow you to one of your next meetings.
Great. I'll make sure. You know what? I'm going to push out an email, and Janice is going to help me remember this. Janice, write this down so I don't forget. I'm going to get the dates of my next 2 presentations because I know one's in Burlington and one's in Ames, and it's with SHRM. And I think you guys should see those anyway. I mean, if anybody can get to and become a member of your local SHRM chapter, or at least get invited to speak, or get me to come down to the local SHRM chapter, I'd be happy to. I've done many of them across the state, and they're very, very well received. And these are opportunities for you to get connected to those people. Thanks, Paul.
Thank you.
Okay, thanks, Janice. Okay, let's see. See if I've got another question here, another raised hand. Let's see, and I'm not seeing any more questions. No questions typed in. And I know we're a little bit after 10, so I might have lost some of you anyway. Well, I hope you guys found this valuable and not just regurgitating, you know, the same old stuff. But it just was brought so to my forefront yesterday that there are still so many agents out there that are not stepping up and demonstrating value and talking to their groups about the new opportunities that they have with defined contribution, and then even in the proposal, I have a sample copy. In fact, I'm going to bring it to our Agent Advisory Council next week, a sample copy of a proposal that this client gave to the agent and I from their other agent. And so it's interesting just to see what's out there in the marketplace in terms of proposals. What are customers looking at, and how are we demonstrating our value? And together we'll talk how else KHI can help you make sure you're putting a good foot forward when you're putting your proposal together. So, and I don't see any other hands raised, and I don't see any other questions. And Marcia, I'm sorry I missed you. I don't see your question typed. Whoops, okay. Oh, I think I got it. Oh, thank you. Okay, I found your question. And let's see, here's Jared. Apologize if I've missed the info in any messages, but I know the open enrollment date is 11/15, but when are we going to start seeing the new material and rates? For the ACA plans, if you're talking ACA, which is 11/15 open enrollment, it is. It's like, Janice, you haven't seen anything yet, right?
I have not.
And the reason is a lot of this they're still waiting on approval. I remember in the Co-Opportunity Health trainings this past week, they said that they don't even have division approval yet, insurance division approval. So until they do, then we'll get it, I'm sure, in electronic fashion. And then we'll probably start to get some of the printed material that'll help us with some of the side-by-side comparisons and brochures and things like that. So be watching. As soon as it's approved, I'm going to guess they will kick out their SBCs rather, their outlines of coverage, rate sheets, and all that stuff. We're going to get barrage. So be watching. Please read when you get an email from KHI Solutions, we try to limit those to the things that we know you really need, and then they're always archived on our KHI Agents website. So if you don't get a chance to read it, you can go back. But we'll be pushing out, and I apologize now, we're going to be communicating like crazy here in the next several weeks with all the Med Advantage stuff, PDP, and then we get into all of the ACA stuff. So thanks for that question, Jared. And then another question there, Marsha, I got you. Is Coventry going to give us training or product information for 2015? Yes, as a matter of fact, we know that there's some training coming up. They might be in the same position that Co-Opportunity and Wellmark is, that I can't give you too much yet, but I will follow up. In fact, Janice, I'm going to ask you to make another note on Coventry because we've also got they're coming to talk to our Agent Advisory Council meeting next week as well to just give us a better understanding of what's happened with the Coventry merger, as well as what's going on with products and training. So more to come on that, Marcia. Thank you. Stay tuned. We'll be pushing that out. And then I got your question there, Paul, about is the shop tax credit only available for 2 years? And it is 2 years. And they've said 2 consecutive years, so it's kind of like once you take it your first year, you take it your second year, of course, assuming you qualify, and then you're done. And then Jared also says, okay, how about grandfathered, grandmothered renewal rates? Yep, same thing. We've gotten, I'm trying to think if we've gotten any 1/1 of 15. Of course, the 1/1s just came out from the group side for Wellmark. So we will now have 1/1 rates. And I think Co-Opportunity is real close. So I knew that we were expecting something from them as well. So it's all right about now, you guys. Be watching your email very closely. And, okay, let's see. And then I think, trying to see if I got any more questions. Here's Donna. Thank you, Donna. It says, a Coventry under 65 client called. Coventry sent them a letter and is canceling their plan for next year. Is Coventry sending the agent the same info? We haven't seen anything yet. You know what? We knew, now I knew this, I hope that you guys knew this, that what I told you this morning, and that Coventry was going to terminate all their grandmothered plans and force everyone onto an ACA plan in the individual market. So if your client's been contacted already, if you're looking for, if you'll jot this down for me too, Janice. Janice is going to go, wow, I'm not coming to this one again. I'm kidding. But I'm giving her all this help to help me here. Donna Fields, if you'll get her that information about Coventry, and then maybe we need another blast out to say, here's the information that your clients are getting. But I know not all of you do Coventry. But we'll make sure we send that for sure to you, Donna, and maybe we'll end up putting out, maybe we'll put another news flash out about Coventry and just make sure people see the communication that they're sending, because normally they let us know what that is, and we appreciate it when they do that ahead of time. So let's see if there's any other questions here. Okay. Let's see. Yeah, I'm trying to see. I don't think I see any other questions. Want to miss anything here. Okay. Well, I apologize for going over a little bit. I hope it was worth your time. It's a little after 10, about 10:10. So listen, if there's anything else, of course, always call a member of our staff, 800-657-8033, and then we'll look forward to catching up with you guys in our next month's call, the second Friday of every month from 9 to 10. Thank you so much for your support, and have a great weekend and a great day. Talk to you soon. Take care. Bye-bye.